and out services for Wichita State University. I'm grateful for the chance to come and talk with you all today and just share a little bit about what we've all been, what's generally on our minds, and especially in the past year and a half of connecting with our students in new and different ways. So I just want to tell you a little bit about our story. I know every campus is different, and how we choose to engage with our students is different. So this is our story and our journey about how we went from having something that started as a fashion choice to becoming a symbol of hope and mental health support on our campus. So this program that we have is called the Suspenders for Hope program, and we started in 2015. We were engaging in the Garrett Lee Smith grant, and really trying so hard to address all the needs across our campus. It was at that point that mental health services, the demand for those were really on the rise. And so we were looking at different options of how do we not only show our students and our faculty, staff, our whole community support, how do we get them information? How do we help us all feel connected in this together? And really, what we were doing at the time was what we call a hodgepodge, right? We would have an event, and we would have a campaign. We were just throwing a lot of things out everywhere to try to meet all the needs of our campus. And we were spread really thin and still not meeting all of our campus needs. And so as we're trying to figure out what it is that we needed to do to not only meet our campus needs, but to do it in a way that maybe was more cohesive, is we made a shift. And we made a shift from a single outreach events to a branded mental health awareness campaign. Suspenders for Hope is the idea of Suspenders initially was that they support your pants, and we were supporting mental health. It started actually with Dr. Suspenders on campus. It was a orientation program that we were doing, and a therapist was really in a game show host role and wearing these suspenders. And our students started calling Dr. Suspenders and started actually tweeting about him around town, being like, "Oh, I saw Dr. Suspenders." And so it was something that was a very organic start to us. And we said, how do we take this idea that our students have really connected with, and how do we make that into something that we connect with them in a different way? So we wanted to make a shift, and we started the Suspenders for Hope campaign with our shirts that you can see here. And we said, how do we go from this being a shirt to not just us supporting as CAPS, supporting our students, but for the whole community and every individual on campus to be part of supporting and connected to each other? How do we create that community support? And Suspenders for Hope was really our answer to that. It has evolved into a strategic, coordinated, comprehensive approach that is tied together under one symbol to empower each member of our campus to participate in ending mental health stigma and preventing suicide and other deaths of despair. So our program has 4 parts, and I'll talk a little bit about each of them now. So it is an awareness campaign, prevention trainings, mental health advocacy, a mental wellness curriculum. And really, this is how we utilized a branding marketing campaign as a unifying point for all of our prevention and outreach efforts across our campus, and how we were able to take that as a beginning and then move past awareness to education and culture change. So as I said before, the Suspenders came out of a very kind of organic beginning for our campus. And it really was something that we said, how do we expand on this? And so we looked at NASPA, we looked at the AUCCO and other national organizations and looked at the priority areas. And the priority areas for campuses in prevention were all pretty similar. So it's suicide prevention, substance abuse prevention, sexual violence prevention, and mental wellness support. And so we looked at those areas and we said, we see all of these as very connected. So they're all connected in mental wellness, they're all connected in deaths of despair, and focusing on these 4 key areas is something that we utilized into this branding campaign. So to just briefly say what branding is, generally it's having a consistent set of standards for marketing, promotional, all of our materials so that it remains really consistent. Not having a completely different look for every event that we do or every speaker that we have. And that repetition actually allows students to connect to our messaging before we even say anything. They can recognize it and know what it's in relation to, where it's coming from on our campus. And to really make sure that this is something that is seen and recognizable across our campus. So that's something that it actually took a while for us to do. Is we were pretty consistent in everything we were putting out, and we used these color-coded areas to help focus our messaging. So when they see yellow, they know it's about Wichita State in general or suicide prevention. The red is for substance abuse prevention and so on. And so we use that branding and we use that image as a way to meet a lot of our different students where they are. And something that we've done a lot is actually use our strategic communications department on campus to help push messages out and help us actually develop this branding and this specific way of communicating with our students. So some quick examples of some of the things that we do. Everything we do that comes out of camps is branded. So that's our website, it's preparation materials, it's handouts, it's swag. We really love our swag. And we actually asked other departments on campus that if they are engaging in any kind of mental health support or their own ads, to actually use that branding as well, so that we are engaging in that cohesive messaging across our campuses. Swag, I said we love our swag. Anything that we're giving away to our students actually helps turn them into almost walking billboards for our program. So as we continue to promote different education, that's something that we come back to all the time is that branding. We focus on images of hope and resilience and really use positive imagery. This is not to decrease the seriousness or the experience of individuals, but a big part of our messaging is not only mental health is real, that there is ways of having support, there is help, there is hope. And so that is something that we use in our social media, and especially in the first half of the pandemic. I think that it was really clear that everyone was, in our campus at least, was really okay with the idea that things were not okay, and a lot of people were struggling. And so it was, things aren't okay, how do we connect? How do we give you ways to find that help, to find that hope? And social media is so adaptable to individual groups of students. So we're able to put out messaging to specific demographics to help utilize social media where our students already are, and help to give them some of that information and education of what mental health support is like across our campus. So when we're using our branding, we actually are able to expand what that looks like. So here's some examples here of brand, color, logos, kind of look and feel are all consistent. It's saying that we are all supporting the same mission. We're not all doing the exact same thing, but we are all believing that we are a community and a campus of mental health support. And we've actually been very lucky. Our administration has been amazing in supporting us in this effort. And so we able to get messages top down that this is a community that engages in these things. So much so that actually we even changed the name of our department. We were counseling and testing, and now we're counseling and prevention services, so that we can say we really are focused on getting some of this information and connection and programming to our students. So that's a little bit about the overall awareness campaign. I know I'm running through this all really fast, and I apologize. I have so much to say, and I wish I could just talk forever about it. And here you can see some of the examples of the different colors for the different content areas. So apart from the awareness campaign is a series of prevention trainings. So we started in the GLS grant. We brought 3 third-party trainings, suicide prevention trainings, to our campus, and we're really having difficulty in getting our students to engage with them. It's a topic that not everyone immediately wants to take on. And so one of the things we actually did was we created our own suicide prevention training that was incorporated with this overall awareness campaign. And we utilized students' focus groups and said, what do you need? What is helpful? How can we help approach this topic in a way that feels accessible to you? And so we were able to take that feedback and really create training specific to what students saying that they wanted. And one of the things that we utilize across all of our trainings is actually our Share, Ask, Support method. So this is our version of kind of stop, drop, and roll. It's something to remember whenever you're having difficult conversations. You want to ask somebody if they're experiencing suicidality or any other of a number of conversations that people might find difficult to start. You can use this Share, Ask, Support method. And that we found with students has been very helpful, and just verbally practicing how to start these conversations. So we rolled out this training in 2018, and we paired it with our overall awareness campaign, and found that we had in the first 2 years, a 426% increase in engagement with our campus. And so one of the things we actually did as well is if you took the suicide prevention training, you got a free suspender shirt, and the shirts are cute and students like free things. And so it was bringing all of that together, which then students wear the shirts that say, I am somebody who is a support and a mental health advocate on campus. So it just reinforces all of those pieces. Faculty and staff, we all know, have a different role on campus than our students, and we need to reach them in different ways. I have always been amazed at how much faculty and staff want to support students, and they want to support mental health. It's not something that is in everybody's wheelhouse. It's not reasonable to expect everyone to have the same level of expertise. And so one of the things that we did is we created a mental health advocacy program. And so this was to get faculty and staff really concrete, specific resources that they needed, that also allows them to incorporate mental health into their curriculum and into their classrooms. So we created a step of, developed actionable steps, things like taking the suicide prevention training, how to talk about mental health in syllabi, how to engage in our wellness classroom cards and incorporate that into our curriculum. I'll talk about those in a moment, and even give students extra credit for engaging in some of these mental health activities. For us on our campus, it's really important that leaders, administration, faculty, staff model appropriate like appropriate conversations around mental health, that we are vulnerable, that we are honest, that we are showing that it's okay sometimes to not be okay. And here is what we can do when things are not okay. Um, and to wear the shirts on Fridays for Mental Health Awareness Month, for Sexual Violence Prevention Month and Awareness Month, for Substance Abuse Prevention Month, and for actually various actionable or not actionable awareness events across this school year. We wear our suspenders, and we call them Suspenders Fridays. Fridays, we tend to be able to dress down a little bit on campus. And so pretty much you walk across our campus and you'll see a lot of people wearing the shirts on Fridays saying, I support mental health. Something else we ask for faculty and staff is actually to be on social media and to share their stories, and to repost or share content that we've created in their classroom. And we've been extraordinarily lucky in our support. It can be really difficult for any instructor to want to give up any of their classroom time. And we have found that this has been such a priority on our campus that they have chosen to do that. And it's just little bits of time, but it really makes a difference. And one of those pieces, the last piece of our overall kind of programming is our mental health curriculum cards. So that we call them the mental wellness in the classroom cards. And what we did is we developed a set of 32 5 to 10 minutes activities that instructors, group leaders, student advisors, pretty much anyone in a administrative or leadership role on campus can utilize these cards, and they don't have to have a background in mental health. So they take 5 to 10 minutes, and it really allows instructors to infuse curriculum with well-being and connection activities. And so this could be belly breathing. It could be a discussion question that engages students with each other. And on our campus, we set up a system where they can request a set of cards. And we have gotten over 700 requests for a set of cards on our campus. And people will say, I actually only ordered one set. We need more for our department, or we need more for my TAs. And they're finding it really helpful overall. Something that is really important to us is data and evaluating what we're doing. And this is an area where we have really been able to utilize not only applied learning opportunities in our own department, but utilizing other departments across campus. For example, we did a marketing and public health awareness evaluation. And so we engaged our public health, our marketing departments, and actually a few others across campus. And we created an evaluation and to say, how is our awareness program doing overall? And one of the things that we found was that about 70% of students, faculty, and staff across the campus said that they were aware of our program. And what we found is when individuals said that they were aware of our program, they had a significantly higher rate of saying that they believed that Wichita State University cared and supported their mental health, at a much higher rate for the individuals who said they were not actually aware of our program. So there's still a lot of work to do, but we want to always look at the data and say, what is it that we are able to, what's working, what's not working, and make changes. So in the last couple of minutes that I have here, we just want to talk a little bit about lessons learned. There's victories, there's stumbling blocks. We have had plenty of both. And so we just want to share a little bit of some of the things that we've learned in this process. And the first one is that culture change is really what we're after. We're not after adding another program to the university. We're really after adding this as a piece and as a part of our culture. And so culture change is a long process. It's not a single event and then you end it. It's something that takes a long time, and you have to stay in there and stick with it. And that you really need faculty, staff, student, administration, you need buy-in from them. And how you get that looks different, but that overall, you need all of that buy-in from those different groups in order to really have it be a part of the institution. You have to find and make champions for your cause. A champion is someone who really sees the vision that you have and helps you carry that. Upper administration buy-in specifically, they make amazing champions because they encourage that mental wellness promotion from the top. And by having a program that gives language and a symbol that they can use, that's really helpful for them. Again, they don't have to be experts in what you're an expert in, but it really helps opening doors. So we have a picture here of Dr. Terry Hall, who is our Vice President of Student Affairs at Wichita State. And she talks about how it's her job to help really break down barriers. And so she and our AVP of Wellness actually went on a tour of our deans and our faculty to talk about mental health concerns, resources, challenges that they were experiencing, and how they can incorporate the resources that we have available to them. So we have a lot of amazing champions, but the champions are what make this possible. You can't do it by yourself. If you're one department, you can have a lot of impact, but that's not going to get it to the point of culture change on your campus. So, and we're all carrying a lot. We work a lot, and I know generally we're spread pretty thin. So it's really important to bring other departments into this kind of collaboration and campaign. But each department has to have their own role. I don't know where it's at, what it's like where you're at, but I know in Kansas and in Wichita, budgets are finite. They're very finite. Resources are finite. Staffing is finite. And so you can't do it all on your own, but you have to make sure that each department not only has their own role, but has their own victories. And that allows them to really be able to say, here's how we're creating our contribution to supporting mental health and wellness on campus. And here's how we're doing it using our own resources and our own areas of expertise. And really to engage in more applied learning. So, we had the example of a marketing class, and the professor said for a project they were doing, one example of something they could do is actually evaluate our campaign and give us feedback on it. And so that was something that not only helped the students learn and help them incorporate their knowledge and giving and helping us and making our program better, and then they felt more involved in the program. So that kind of reach is something that you cannot create on your own. Don't be afraid to pivot. Don't be afraid to make changes. Finding what works takes a lot of time, and what did work sometimes will shift. So that's something that we are really finding ways to make those shifts as needed. I know my time is up, and so I will just say, I know I rushed through all of that. I am really happy to answer any questions if you want to ask them now when we have our question and answer time, or contact me afterwards. I'm happy to answer questions. It has taken us genuinely years to get where we are with this. And so if this is something you're not interested in, we do have our program for license, but also if you are in this in this journey, we would love to support you. So if you have questions or if there's anything we can do to help you on your own campus, please feel free to reach out. The work that you do is amazing, and we would love to help support you any way we can. So thank you for your time, and I look forward to your questions.
Thank you, Dr. Young. Thank you very much. I actually was taking notes while you were talking because your information was very helpful. And actually, I have questions, follow-up questions, just for my own edification, but I am actually going to let Dr. West do her part and do her presentation, because I feel like some of the things that she might say will fit well with some of the things you have already said. So Dr. West, I hand it off to you.
Thank you. And I was also taking notes as well. And so thank you, Dr. Young. I learned a lot, and yeah, we'll be applying a lot of what I learned. If I could just get screen sharing ability, then I could start my presentation. Okay.
Yes, I believe that you have it.
Perfect. So, you know, I'm happy to hear kind of Dr. Young put that preface of and kind of taking some time to build a culture and kind of taking some time to kind of shift in how we might approach our work, especially when we're doing outreach and preventative efforts. I did want to share as part of this presentation, some things that we did at the University of Florida, largely during the pandemic. We're still in the pandemic, but we recognized that we had a lot of new challenges and that our students were facing a lot of new circumstances that we were ill prepared for and really had no guide, no plan as to how to move forward and how to support students during the pandemic. And so I've titled this Digital Awakenings because we found that there were a lot of different opportunities that we did have in the way of programming and the way of reaching out to our students during the pandemic that weren't necessarily opportunities that we took advantage of pre-pandemic. And so I want to spend, some time talking about a program that was integral to our center and to our campus, which is our Gator to Gator program. But also some other programs and services that we developed along the way as we prepared and sort of put this program together. So just to kind of start by, giving some context to how our programming was put together. We know that, at the end of March of 2020, a great deal of college students were impacted by campus closures, and a lot of uncertainty around, what college would look like and if we were ever going to go back in person. But, in addition to all of the regular stressors we know that they experience in the way of anxiety and depression and relationship concerns, this extra COVID stress really presented new challenges in kind of thinking about how to overcome barriers that students often experience when we are in this pandemic. And so some of the things that we recognize that our students, as well as many students, nationally and globally are experiencing were technical challenges, differences in time demands and trying to shift from in-person learning to, doing things virtually, having to deal with more distractions and, the lack of interaction that they were getting with that in-person learning that was really vital to that social support and that connection often necessary to managing some of those day-to-day stressors. And then we also had students that, again, moving, off campus and going to different locations had problems with accessing technology. And so how do we access those students and how do we reach those students that may not have the opportunities to take advantage of some of the virtual things being put in place to support students? college students we know are a very vulnerable group and experienced several challenges over the course of the pandemic. When we started to look overall at some of the things that students were experiencing, it was overwhelming for us as clinicians and as practitioners, and trying to think about ways that we could support students, during this time. But a few things really stood out to us were areas that we could have some efficacy and could make some inroads to developing programs that could connect and support students. And so we zoned in on 3 areas: isolation, the limited interaction and emotional support that students were experiencing, and that reduction, right, in healthcare and access to mental health care. Because now, again, with our students distance learning, many of them are also distanced from that mental health support that they had access to when they were on our campus. So again, I want to highlight some of the programs and some of the shifts that we made as a center, and really starting to strengthen and broaden our advocacy, prevention, and outreach efforts during the pandemic, specifically targeting things that we knew were barriers and struggles that students experience during this time. And one area was increasing help seeking. Right? We know, that it can be a struggle for students to ask for help, or sometimes even to recognize when they need help. And so, when we're not on campus, to be able to, interact with students or, share information with them directly, it's hard to kind of get those resources and get those things to them in a way that they can maintain that awareness and can, be intentional about seeking help when they need it. And so we started to think about how we could increase opportunities for students to access mental health resources in ways that were more accessible to them. And so one of the things that we developed was our Cwc Talks Podcast. And so our podcast features different episodes related to collegiate mental health, general things, again, related to anxiety, depression, and relationships, and then more specific things, related to targeted communities or targeted topics that we know might be day-to-day struggles or challenges for students. And so I'll pause there just to highlight that as I go through some of these programs, I've included a QR code to more information about some of these resources and some of these programs. And so please feel free to use your smartphone to follow along and to snap a picture of any resources that you want additional information on. But Cwc Talks, we're into our 4th episode of that. And it's something that our students have gravitated towards because of the ease and, again, accessibility of being able to put on their iPods and listen to things related to mental health while they're riding the bus or while they're, in their residence hall or just distanced from campus. And so this was a really integral way for us to maintain connection and also put conversations that are happening inside of our mental health offices, outside of our offices, where it can be digested by our larger campus community. Another service that we developed was our Ask It service. And so again, not being able to physically engage or interact or reach students in that way, how can we connect with them when they're at a distance? How do we consult with them if they have questions or curiosities? And so Ask It provides an opportunity for our students to reach out and ask questions related to anything regarding our center or anything related to collegiate mental health. And so it can range from how to manage day-to-day stress or how to support a fellow student. But those questions are submitted electronically and received by our Ask It team. And our Ask It team are a team of counseling providers that will sit with that information and respond to those questions within 5 to 7 business days. And so we do a lot of promotion up front, letting students know that this is not a place where you submit questions if you're in crisis or if you've got urgent or emergent needs. This really is a consultative space to kind of provide guidance for students for things that they might be experiencing. Here's an example of a typical question that we might get in our Ask It. And again, they may range from how do I support a fellow student, or I've been experiencing, these changes or shifts in mood, and is this something that I should be concerned about? I think a large number of questions that come in from our students sometimes are, is this problem enough for me to come in for counseling? And so I will get those counseling or therapy worthy types of questions, which is really nice to see, because students have that curiosity, but it also provides us an opportunity to give them education around the importance of attending to their mental health, and to reassure them if they are uncertain about concerns that they're struggling with. Another thing that we wanted to make sure that we shifted into was reaching students virtually. And so again, we offered a lot of programming within our offices and on campus related to collegiate mental health. And so sometimes that might be programs that we'd already had developed, or sometimes programs that we collaborate with other campus partners. But during the pandemic, that isolation, that distance also impacts the ability to collaborate and to put things on in person. And so we had to find a way of shifting our programs into an online or virtual format for students to be able to, again, access at their own time and make available, for them when they didn't have opportunities to access those resources on campus. And so we developed a virtual workshops and events program where, throughout every semester, our staff, will submit programs or workshops or presentations that they're having throughout the semester, and students can directly register for those workshops online and attend those as well. We wanted to make sure that students still felt connected, right, in attending our workshops, even if it's virtual. And sometimes when we're doing in person, we bring our swag, right, those promotional items that kind of remind students to pay attention to their mental health, or give them contact information about your center. And so, with our virtual workshops, we often will market and promote using social media. Putting together different graphic designs, around different types of workshops that can be eye-catching to students, with that direct registration information there. And so when they're on Facebook and Instagram and TikTok, they can see that information. And again, it's coming to them and not something that necessarily they would be able to see unless they were walking by our offices or on campus. The other thing that we do is we offer the opportunity for students to sort of Zoom away as opposed to walk away with swag. And so as they attend our virtual workshops and presentations, they can leave us feedback. And after that feedback, select one of our swag items that we have available for them, and we'll mail it to them at the address that they provided. We get a lot of great feedback from our students about that opportunity, because we have a lot of students that study at a distance in general, even when they're not in a pandemic. And so when we provide opportunities, again, for them to feel a connection to not just our center, but to our campus, they really value those opportunities. Another thing that we recognized was really important, again, in supporting our students through our mental health, was peer support. And so research, that we were collecting was showing that students, again, were lacking that engagement and feeling isolated, and really seeking opportunities to connect with fellow peers, or as, we refer to them, fellow Gators. And so that, prompted the development of our Gator to Gator program. And so our Gator to Gator program is a peer support program where we train our UF students on emotional support and crisis intervention skills. And so it's a non-counseling service where students essentially are just providing that emotional support and crisis intervention. And, we've structured it in a way that students, again, know that it's not to be used for crisis, and that if they are looking for counseling services, our, Gator to Gator ambassadors are trained to provide resources and information that connects students to more appropriate resources on our campus that might meet their need. Our Gator to Gator program started internally to our center. And so we already had student ambassadors that we used for outreach and helping us to destigmatize mental health and to get information out to students about mental health resources on campus. And so we piloted with them and training them on this program and offering an opportunity for students across our campus to, again, Zoom in virtually and connect with the student for 30 minutes to process, a variety of concerns or stressors, or just to get information about campus resources or community resources. And we found that there was great success in it, again, because it met the needs that students were having, not just during the pandemic, but in general, and wanting that social connection and wanting to feel like I'm not alone and struggling through this. So after this past year, we've actually opened up our Gator to Gator training program to other departments and programs on campuses. And so not just students within our office, but sororities and fraternities, different colleges and programs, different offices, but essentially individuals that work with students, because as a peer-to-peer program, we're wanting to make sure that mental health support is seen as a campus, right, concern and as a campus initiative, very similar to what Dr. Young was speaking to of Wichita State. And so with that training program, we found that we're able to work both with students and with staff and faculty in providing them with training around these skills, these active listening skills, these emotional support and crisis intervention skills, where they're able to support students where they are. Because we know that it's our counseling services, our clinical services that are typically the last to be used, right? We're the last, right? Sort of stop for students that are in need or for staff and faculty that are in need. It's those that are seeing them on a day-to-day basis that have a stronger understanding of where there are concerns and can provide that immediate support. And so our training program is broken up into two parts, where the first part is essentially training all of these skills and then providing opportunities through experiential exercises for our trainees to practice different role plays and to practice different experiences that we know that they may encounter, when they're working with students. And then our second part, again, is empowering them with information and resources, not just on campus resources, but community resources that might be able to support collegiate mental health, from semester to semester. Our training program, again, really emphasizes that promotion of social connectedness. And so we do emphasize that Gator to Gator is peer-to-peer, whether that's student to student or staff to staff or faculty to faculty. From that program, we wanted again to capitalize on the virtual opportunities, right, that are there in reaching and connecting with students. And while some students might feel comfortable meeting in person, right, through Gator to Gator with another student, some might want the anonymity, right, of just being able to express a concern, but still receive emotional support. And so we launched our Request a Letter of Care campaign, which essentially is an asynchronous Gator to Gator. And so we train our care bearers, is what we call them, or letter writers, on the same intervention skills that we train our Gator to Gator ambassadors, right? Those emotional support, crisis intervention, and resources and information and educational skills. So that as requests come in or comments come in from students, they can respond with a letter of care to what that student has experienced. And so here's an example of something that was submitted by a student. And so, sometimes the comments, right, that might come in from our students are very brief. Sometimes our students might share a little bit more about what they're struggling with or what they're being impacted by at that time. But what we'll do is we'll de-identify them. And so we'll take that information and share it with another care bearer or a letter writer. That letter writer doesn't know what student they're writing to. They're just responding to the content. And then a clinical faculty member within our center will then connect the letter that was provided by the care bearer to that initial student letter request. And so here's a brief example of what a letter of care response might look like from a care bearer. And so again, it doesn't matter necessarily how short or long the comment, the question, the statement is that's shared by the student. Our care bearer is going to respond again empathically, share information, and try to connect that student to resources if that's something that might be helpful for them at that time. Excuse me. We also recognize that as things shifted more to a hybrid campus during the pandemic, that as a counseling center and as a center that provides prevention and outreach services, that we wanted to make sure that we were also being mindful of that shift and taking opportunities of things that could be happening more virtually and providing a sense of community and connection for our students. And so one initiative that our peer ambassadors launched over this year was an Aware Live program. And so, as I mentioned, our student ambassadors provide outreach and education to help destigmatize and promote mental health and wellness. And that was primarily done in person. And so capitalizing on our youth and their comfort, right, and getting on Instagram and getting on TikTok and communicating with their peers, they launched Aware Live, where they have different topics that they will discuss related to collegiate mental health. And students can, again, come on in live when those episodes are happening to both get information and connect with students, because they'll often do a Q&A and respond to inquiries from students across our campus. We also wanted to create a sense of community for our students and feeling connected to mental health and feeling connected to our counseling center. Frequently in the past, we would hear students refer to CWC as the CWC. If I need something, I'm going to the CWC. And there really was no sense of ownership that we felt our students had, not just of our center, but also of their mental health. And so we launched a Mycwc campaign, which essentially is, again, a peer-to-peer focus, where we have students talking about how they use CWC to support their mental health. And so students can come to this page. We change out the graphics and information with information that students have shared, especially around how they use their CWC, so that students can kind of continually engage and interact with different information or different ways of viewing or thinking about using our center. And so here's an example of a video that sits on our Mycwc page.
Hi, my name is Callie. I am a fourth-year psychology and women's studies major here at UF, and I use Mycwc to prevent burnout. So workshops like yoga for stress management or for body confidence really help me to reconnect with myself, center myself, and I love listening to the Cwc Talks podcast while working out or going for a sunset walk. The CWC offers tons of helpful resources, and I really encourage you to check out the huge variety they offer by exploring this site.
So that's, a helpful video for us. Again, students kind of sharing information about how they use resources, and not just how they use resources, but highlighting again some of the struggles that they have. And so that normalizing of mental health, that getting that information into regular day-to-day conversations. We heard Callie kind of highlighting that one of the things that she uses Mycwc for is for burnout. And so students, as they visit this page, can again learn how other students are using mental health services to support a whole host of concerns that they might experience. We also wanted to make sure that students could stay up to date and informed with things that were always going on throughout the semester related to mental health. And so we had not previously had a newsletter, but thought, let's, launch one and see what happens. And we've attached our newsletter to every event, every promotion, every workshop. It sits on our webpage. And so there are a lot of opportunities for our students, staff, and faculty to subscribe to our newsletter. And we use that as an opportunity, not just to promote and advertise and highlight things that we have going on in our center, but also to share information related to mental health and to educate and provide information about different opportunities that might be going on our campus related to mental health. Again, in keeping in that same vein of trying to support more peer community, our aware ambassadors, our student ambassadors develop their own newsletter. And so that newsletter is promoted through our general, subscription. And so if you subscribe to our newsletter, you're able to get both our counseling, and wellness newsletter and the one newsletter that's developed by our students. And so trying to find different ways of engaging students, virtually that is accessible to them. We encourage our students, again, to follow us a lot on social media, whether it's YouTube or Facebook or Instagram. We try to put a lot of new and fresh content on those social media sites to grab their attention and to help with that spread. Because even if your entire campus or your entire population you're trying to reach doesn't follow you, we know that word of mouth from peer to peer is so important. And so we do track, when things are shared and when things are commented, because we know that is more of a way that we can get information out to our students. Just one last initiative that we've launched over the past year was our Reddit initiative. Again, wanting to move to communities where we know that students are and where they're engaging, as opposed to, traditional methods of having them come to you or call you if you have a question. And so over the past year, we've started doing CWC Ask Me Anythings on Reddit, which provide opportunities for, again, students to, come on in virtually and ask questions of our center or ask questions in general related to mental health. This was a scary process for us for reasons that you can't imagine. Like sometimes Reddit is not the most forgiving or friendliest of environments. But again, that importance of adding to a conversation that we know is already happening. We know our students are engaging in conversations around mental health on Reddit. We know that they're engaging in conversations around our center on Reddit. And so by not kind of stepping in, into that area, you're missing an opportunity to sometimes share information or clarify misinformation or answer questions, again, that connects students to your center and helps them to reach out for help. We did, when we announced our very first Reddit, get some feedback that wasn't too promising. We were kind of nervous, but at the same time did get some encouraging feedback as far as students saying, we're really happy that you're coming to do this. And so please ignore, any negative commentary that you might get in coming, because this is a really good thing that you're doing. And of course, what we did find when we did do our first Reddit is that it was a valuable experience. And so we provided opportunities for the Reddit community to see our faces, to know who it is that was going to be asking their questions so that they, could know that it wasn't a robot that was communicating to them or some kind of a setup and trying to, solicit information from them, but not really be supportive, but really trying to put a human connection to that interaction as much as possible. And so our Ask It team was able to come together during these scheduled times that we promote, this opportunity and through, a shared Google Doc, construct responses to questions as they come in from students. And it both gives us an opportunity to share information, as I said before, and to sometimes clarify things that could sometimes become barriers or challenges for students seeking help. And so here's some examples of questions that came in or that have come in, through our Reddits. And so, anything from what workshops do you offer to what workshops do you like or do students find most enjoyable? Other questions, when are we coming back? And so that was something that we were, very excited to get after that experience. But again, I've included a QR code. And so if you're interested in getting more information about our Ask It, that can take you to more information about those that we've held over the past year and connecting with our students. And then last but not least, we have segued into TikTok as another avenue in connecting to students and making mental health more accessible to them. And so, we are encouraging, again, our students to follow us, our staff, our faculty to promote that social media availability and opportunities there for students that they like that medium, so that we have a broader way of communicating and bringing information and support to them. And so that is all I have in the way of an overview of our Gator to Gator program and ancillary programs that we have at our office. And so I'll stop there so we can segue to any questions that you all may have for myself or for Dr. Young.
Thank you, Dr. West. Both yours and Dr. Young's content is just incredible. And again, I was taking notes as you were talking. So I encourage the attendees to ask questions in the chat, or I think the chat's the only way, if I'm not wrong or mistaken, Ashley.
There is a Q&A option.
Okay, Q&A, yes, the Q&A option. I did have a question, since I can't put my question in the Q&A and I can verbally ask, is I'm interested in Dr. Young, if you could expand a little bit on how you engaged administration, how you got their buy-in for this. I sometimes think that is a challenge for campuses. And so I'm curious as to kind of how you engaged them and got their buy-in for your program.
That it is a huge challenge. So that's a really awesome question. And actually, usually I've even been able to get our Vice President of Student Affairs, Dr. Terry Hall, to actually present with me. Because, and one of the things she'll tell you is when we first started talking to her about this, she was like, okay, yes, that's nice. It's another program, and we'll move along in a month and it'll be a different program. And so the first thing was we started talking to her about it, and then we kept talking about it. And we began to show kind of the benefits and what it is that how engaging in this helps actually relieve some of the pressure that people were experiencing across campus, and other people that were reporting to her some of the pressure that they were experiencing. So it was, and then it's getting them involved. So it's not just letting them know about this program, but in having conversations, saying, what is it that you feel like our campus needs? What is it that you're hearing from faculty, from staff, from students, and incorporating that feedback, and then helping, really, in every organization, again, it's different, but it's getting kind of that buy-in up the line. And then as we're giving, our AVP, my AVP information that gets to the AVP, and then the three of us have conversations, and then that information goes up. And so it's really being consistent, and you gotta tell your story. And I'm a psychologist, okay? We don't like to be like, let me tell you the wonderful things I'm doing. And so that's actually a shift for us that we had to make, was really telling our story and showing how it's going to really benefit the campus to continue to engage in that. So that's kind of the beginnings of how we did that.
I like that. Consistency is key. And tenacity, I'm sure had something to do with it. And I do like what you said when you were talking about the process of developing your program and how it's become what it is now, is that it's years in the making. Yes. So I think that sometimes, even in your comment about, presenting this idea to administration, you have to go back and remind them that this is happening, this is really happening. And then, just understanding that it is a process. If you want to develop something really robust and that of value, sometimes it is years in the making.
Yep. And you know, really utilizing all of those different resources. I think Dr. West hit that point so beautifully, and what she said over and over again. It's, you know, it can't just be us. It's got to be students with each other, or it's not going to go very many places.
I wholeheartedly agree. So there is a question for Dr. West in the chat. It says, how many staff or students are needed to manage posting content on all of the university's social media accounts? That's a fantastic question.
Yeah, we actually have one person that does our posting. It could sound cumbersome at first, but we actually do cross posting. And so we will post on Facebook and do cross posting. So whatever is posted on Facebook would automatically post to our Instagram and our Twitter account. The only outside account that we have to post separately into is TikTok.
To add to that question, do you internally, I guess, handle all of the postings, or do you contract with, I know that sometimes there are people who will post, you give them the content and then they create the post themselves.
Yeah.
How do you navigate that?
We actually handle that internally. So we have the advantage of having a graphic designer within our student life department. And so when we get information related to a workshop or a presentation, we'll send that content to that designer. And so she, you know, using Canva or whatever, you know, other tool, you know, she is using, will put something together for us and send that to the individual responsible for posting. And when you do the posting, you can schedule those. And so I might have 10 different graphics or 10 different things that I'm wanting to share. I don't have to necessarily remind myself every day to post them. I can schedule them at one time and it kind of sets itself. I think the biggest challenge, I think, for folks in starting to use social media is just getting the content to post, because without the content, you don't build the followers, and the followers is what brings the attention to the content that you post.
Thank you.
Mm-hmm.
Any more questions from the audience? I don't want to hog the floor.
There is a question in the chat.
That was for Dr. That's the answer that Dr. West that's the question Dr. West just answered. I do have a question for both of you. From beginning to now, how long did it take for you to get to this point? And then at what point in your development did you have that kind of, I don't want to say aha, but that place where you thought, yes, we're here, or yes, this is definitely moving in the right direction and we have, you know, rooted ourselves now?
Dr. West, do you want to start?
I think it's probably taken us with all of the initiatives, maybe a good year and a half to do it. And so again, it does take some time and patience, especially, you know, when things start to go a little bit wonky. But I think, you know, when I knew that it was successful is when I'm not having to do as much marketing and promotion around it. So when the students start finding it, when the staff and faculty start requesting it and looking for it, then, you know, as Marci pointed out, you can kind of see it's becoming a part of your culture, kind of a part of what folks are expecting or hoping for.
And for us, like this process was gradual, and it really was something that was really helpful to us was the way that the students embraced it. And we said, okay, we're on the right track. What are the next steps? But it's been a good 2 years for us. And that's been a 2 years of pretty consistent effort. So And then we don't stop. So we never stop. And so that's a piece of it, is there's always going to be the next step. But it took us about 2 years to say, this is what we really think we have. So.
And then what are your thoughts on sustainability? How are your programs going to move forward and continue, engaging the students in the way that it has? Is this something that you feel, now that you are, a year and a half, 2 years in, it's going to continue, or you are creating that cultural change on campus?
For us, we wanted to be intentional about building in sustainability from the beginning, because we didn't want it to be, again, something that we did as a one-time event or one-time thing to go, just to go beyond that. And so we were intentional about looking at opportunities to expand it across our campus. And so initially with our Gator to Gator program, our trainers are clinicians within our center. But this is a non-counseling program, and so trainers do not have to be clinical staff. And so looking at opportunities to connect with a lot of our different programs on campus. And so we, have expanded our trainers to, students, graduate students within our psychology department, within our counseling department, who again have a passion for collegiate mental health and can kind of help support us both in spreading the initiative and in training and supporting it moving forward.
Sustainability has always been something that's been very much on our mind as well, because you don't want to start something that just gets dropped. And part of that for us is that piece of involving other departments and involving faculty and staff. And so it's not all coming from us. Like for me, one of the most beautiful moments is sitting in a meeting where, I walk in or somebody else in another department is talking about what they're doing to support Suspenders for Hope, and we support you. And they're like, we're doing this cool thing. I'm like, yeah, you are. That's all you. So it's ownership. It's shared ownership.
Sure. I like that idea of shared ownership across departments. I love that participation across departments. And that is one of the things that OCI is trying to support when we support campuses doing student wellness initiatives. I think that moving forward, that is going to be a huge sustainability piece. There is a question in the chat, and it sounds like it's for Dr. Young. At Wichita State, one of the elements you mentioned is a mental wellness curriculum. Were you referring to the card decks, or were there additional parts of the curriculum?
So that is one of the main pieces, is that card deck. We also offer a few other pieces, suggestions for what to write in syllabi. We offer some specific trainings and support for our faculty and staff. So it is, but those wellness cards are really something that they can just pick up and in 5 minutes start using. So not having to have a lot of training in them is a big portion of what makes them usable for our faculty and staff. So that's mainly what I was speaking to.
Thank you. Any more questions for our guest speakers? Well, maybe people are thinking, and as they are thinking, I will say that we are going to put the registration link for our next webinar in November. I believe it's November 10th. Same time, same sandbox. And that topic will be cultural competency, meaning, stigmas, and support. So Feel free to register at your leisure, but before November 10th. And again, we will be offering CEs. And again, this is a free education opportunity. And yeah, I would also like to say, if anybody along the way has any questions about the Ohio College Initiative or the Rise and Thrive webinars, feel free to reach out to me. I will, or Ashley, can you put my email in the chat, please, for everyone? And please visit our website as well. I hope that you have found this information very valuable and useful. I know I have, and I don't even do direct service, but I've gotten lots of great ideas for networking opportunities and further educational opportunities as well. So I want to thank Dr. West and Dr. Young. Thank you so much for presenting on your programs. It sounds like you guys are doing phenomenal work with these programs, and your due diligence, it sounds like, is paying off. And we look forward, at least I do, I look forward to seeing where it goes even further for both of your campuses. This is really wonderful. And I hope that some of our participants maybe even reach out to you one-on-one as they develop their programs on their campuses. It sounds like you would be a valuable resource for them as they develop, if not even a cheerleader, and just say, hang in there. You can do it. It will happen.
Yes.
Any final takeaways from either one of you? If I know that we are having campuses looking into developing further their student wellness initiatives. And so what would be, I guess, a major takeaway for them from both of you?
I'll start if that's all right. I would say just keep going. It's hard work, and it's really easy to have one setback and feel discouraged and say, well, I should just stop. Just keep going, and it can't all be you. So it's got to be everyone, and it just takes time. So it takes time. Keep going. Start where you're at. You don't have to have it all done tomorrow.
Yeah, I think I would definitely piggyback on what Dr. Young said about, the patience. It does, sometimes take some endurance, but there are ways to kind of keep it fresh, because it can feel overwhelming to kind of see a program, but a lot of what we did was building on something. And so even if you are just starting small with one thing that you're trying to, get started or get launched, using that as your pilot, or using that as an opportunity to see what other advantages or what other things may kind of present themselves as opportunities to pursue. But you just need to do one thing. And I had seen sort of a comment in the Q&A earlier about how do you kind of keep up that motivation or keep up that incentive. And I'd say, again, you can't do it alone, and bring in fresh voices and bring in fresh ideas, because we do get tired by the work. And so bringing in, different people within your center, within your area, that can not only bring in fresh energy, but fresh ideas can be invigorating and keeping the process going.
Great. Thank you so much, both of you, for this wonderful information. And that pretty much brings us to the end of our webinar. I hope this has been a wonderful Wednesday afternoon. And Marci or Rosa, do you have any questions for us as we depart?
No, thank you for having me.
Oh, no, thank you for participating. We really appreciate it. Ashley, anything at the end?
Yes. So as Juliana said, for our next Rise and Thrive webinar in November, I put the registration link in the chat box. If any of you are interested in that, I also put Juliana's email and Prevention Action Alliance's website. Under that, you will find the link to the evaluation for today's webinar where you can submit your information for your CEs. Also, I will share my screen for the QR code that you can scan as well to access the survey. Other than that, I will leave this up here for a little bit as people kind of trickle out and if they have any questions regarding CEs, but that's all I have. And so Dr. West and Dr. Young, thank you so much for being a part of this webinar today. We are so glad to have you and learn from you. And I'm just so thankful for your guys' work. And so if you guys don't have anything else, you are free to go. I'm going to leave this up here as people kind of trickle out.
Thanks, Ashley.
Yep.